Is fever normal after a baby has just been vaccinated, or them being fussy or trying to look for things and scramble for everything and wanting to sleep most of the time after a vaccination session? Is that really normal? This is what we're going to be discussing about in today's video. So, karibu tana. Hi guys, and welcome to Dr. Saru Pendo TV. It's another beautiful Sunday to get to be on your screen so that you can be able to learn a few of the things I know of, and even just have a discussion with you guys so that we can see how we can better our babies and better ourselves as women. And for the men who like to watch me as well, how you can make your women's life, the women in your life, it could be your sister, your mom, or even your wife, how you can make their life better by watching this channel. So karibu sana. If you've not subscribed to Dr. Pendo Saru TV, please do so. I'll give you a second. Done. And make sure you hit the subscribe button and the notification bell so that you can always be notified on Sunday when I drop these gems. So yeah, what do you expect? What should you expect when you're just coming from your vaccination for your baby, especially the injectable ones? And we're going to discuss this coming week on the vaccination schedule as per Kenyan protocol. So for the ones who theirs might differ a bit, or they have additional vaccines, or majority of the times you'll have additional vaccines to the ones that other countries are receiving, then you could just take note of what is mostly standard for all babies worldwide. And then now, of course, what works for you depending on the settings, because even in our country, there's some areas where babies are not given malaria vaccines, where in other regions they're given the malaria vaccine. So that's what I'm talking about. So the injectables mainly are in the 6th week, 10 weeks, for 10 weeks, I think in 9 months. We're going to go through the schedule, as I said, next week. But what to expect when you're coming from this? I know most of the time it's not even with the first-time moms only, but for all moms, even for me, every time I have a new baby, you don't know what to anticipate, because babies are totally different, and sometimes you might find this one acting this way and another one acting a different way altogether. Vaccines are normally painful, especially the 6 weeks one and the 10 weeks and 14 weeks, because of the part of the vaccine composition is for tetanus. As you can see, this is like the injection site. So some of the things you're going to experience are injection site, tenderness or pain. And every time the child is trying to move their leg, you can see that is where the injection site was. And because of this, you have to anticipate what are the general signs and symptoms, or what they may present as. And then, of course, if something peculiar, something that is strange that you might not have heard from this video, or you've not searched it online and you've not heard about it, it would be good for you to seek medical advice from your nearest healthcare facility. So yeah, what do you anticipate when a baby just comes from vaccination? Fever, low-grade fever. You anticipate that there might be a bit of, when you're touching them, or they're warm to touch or hot to touch. And that is why I normally recommend for most moms, when you have a newborn, it's good to have some of these gadgets, which we're going to go through again on them. A thermometer is one of the things that you need to have in your home. It's very, very important, because instead of just having to feel like this baby could be hot, or this baby is warm, or this baby is normal temperature, this is subjective, but you need an objective point of view as well. And this will help you, having a thermometer in the house will help you to be able to identify, yes, this child has this problem now, and this is how we're going to deal with it. And we're going to discuss how high is high for a newborn in terms of temperature. So when the temperature is high, then we'll discuss on also the things that you can give to be able to ease the pain from the baby. So yeah, fever is one of the things that you anticipate to get. The second thing, they might be very fussy. This is because mostly of the fever and the pain. because they cannot be able to express themselves in a verbal manner to discuss or talk with you and tell you how they're actually feeling, you might realize that they might be slightly more fussy than they are usually. So not wanting to slightly breastfeed, not wanting to breastfeed is actually a danger sign, but being fussy when they're trying to breastfeed, just crying a lot, it is all part of the fever sequelae, or even just because of the vaccine effect on their bodies. So 1, fever or hotness of body. 2, you can have a fussy baby. The third thing that you anticipate to find in a baby is they'll try as much as possible to not want to move that leg. Actually, it's both legs that are normally injected even from the 6th week. Oh my God. It's so painful to the parents as it is to the child as well. So you might notice that they don't want to move that limb, mainly because they are feeling pain. That is one of the things that you might also identify in your child or in your newborn. The other thing that, the fourth thing that you can see or we anticipate to see from this child, I already spoke about the fussiness and crying a lot, but you can also anticipate to see that they're a bit sleepy, or rather they're just trying to avoid the whole scenario because of the pain. I'm assuming it's because of the pain, because tetanus is actually very painful. For those ladies who have had to get their tetanus shots during pregnancy, or even when you're in your childbearing age, when you're in high school or primary, I remember we had a campaign of injecting tetanus in school while I was in primary school. I think I got a shot then. But yeah, you can only imagine how sometimes even your arm swells, you don't want to move that arm. And part of the 6 weeks, 10 weeks, 14 weeks injection has tetanus as well as part of the vaccine. So you can only imagine what they also feel on their tiny little muscles. So be gentle on them. So sleeping a lot, you might notice, but please do wake the baby up every 2 to 3 hours, at most 4 hours if they're much older, like 10 to 14 weeks. So that they breastfeed. Don't let the baby sleep too much because they're feeling a bit not okay on that particular day of vaccines. For most babies, these symptoms or these signs last for about 24 hours. By the 48th hour, you find that they're back to their normal self, they're moving their legs again, they're breastfeeding well, they're no longer sleepy. If they were active babies, they're back to their activeness, they're not fussy, they're not crying again. But if you see that it is persisting past 48 hours, however, if the symptoms are diminishing, not like you can see that the fever is increasing much than it was the earlier hours, the 24 hours, 48 hours, it's slightly diminishing, or it's actually diminishing, or it's slightly going on the lower side, but it's still high, or they're a bit fussy but not as fussy as they were, then you can try to observe. But if you see that it's worsening, then please, you have to go back and report that you think your baby might be having a reaction to the vaccine. It is very important that you know if you're having adverse effects, like the baby is having like a fever of 38.5 and above, or 39, before you're even trying to think about giving anything for the fever, please try to be going back to the hospital to inform that you think you're worried about whatever is happening with your child or your newborn. So yeah, I think there's a you don't even actually need to, you just need to, for the Kenyan women who have kids, the Kenyan women mothers, or the Kenyan mothers, sorry, why am I having a hard problem getting this together? So the Kenyan mothers will just get your antenatal clinic book and just go with it, and you'll be assisted, and everything will be followed as per protocol. So yeah, no, baby is fussy, baby is crying, baby is too sleepy, and you know they're in pain. What can you do? First, there's something that you can do for the area, that is the place that has been the local site, the place where the baby has been injected, which is on the thigh. You could use an ice pack. Some of the milk I've expressed and stored for my darling, so I'm going to use this as the ice pack, and then I'll definitely take it back to the freezer. Make sure you cover it in a piece of cloth so that it does not have direct contact. The ice pack does not have direct contact with the baby's skin. And then you try to taste it, not like this. This other side does normally doesn't have a lot of sensation. So try to touch it like this and feel if the coldness or the coldness of the eyes is all, and then you gently just press on that area, just like that. The other thing you can give when the baby is having fever, and definitely they will be having pain because of the injection and because of tetanus, as I already told you, it's normally a very painful vaccine. You can give paracetamol or any pain meds as prescribed by a pediatrician. It's good to ask if you're at the clinic, what can you give and how much should you give for your baby so that you don't overdose or underdose your baby. And most of the time, what you have to do is just to try to be there for the baby, because at this point they're feeling very vulnerable and very needy. So despite the fact that you might be wanting to give the paracetamol or give the ice packs to try and make it a bit easier on them, what they might need the most is cuddles, if you know what I mean. So just cuddle your baby, stay with the baby, and make sure that you're reassuring them. They'll feel the reassurance with your cuddles, and it will help them to ease on the pain. And usually in 24 hours, we shouldn't even repeat like the dose in 24 hours. After 24 hours, the paracetamol, it's normally not necessary, because the baby would have calmed down, the baby would have been fine. I hope this video was informative and of great use to you. But if you do have any questions or concerns, do comment down below, or you can follow me on Facebook at Dr. Sarah Pendo, or you can follow me on Instagram as well, and you can DM me and I'll definitely get back to you. Until next time, love and love, Dr. Sarah.